handled correctly by the Schwann cell and is causing a toxic response. This toxic response in the Schwann cells that make myelin around the axon, like you see here, is called the unfolded protein response, and is actually damaging the nerve. And that's what, in this subtype of patient, causes the disease. In addition, it impairs a system in the cell that is called the proteasome, which is like the trash can of the cell, which is important to break down and destroy things that are not useful. So both of these events are causing the cause of demyelination and then eventually impair the function of the axon, so the nerve doesn't work anywhere. There is another form of other MPZ mutation which are part of CMT2J disease because they directly damage the axons. So this is just to show you the peripheral nervous system and the axons that are either going to the muscles or bringing sensor information from the periphery to the brain. And so this determines when these nerves, peripheral nerves, don't work anymore, they cause, like many other CMT, motor symptoms like weakness of the muscle atrophy, and symptoms of sensory symptoms that can be sensation, impairment in sensation, tingling, and maybe even pain. So there are several types of CMT1B. Some of them can start earlier, and some of them, like in kids, and they're maybe more severe, and some of them that start very late. And these are this form of axonal CMT2s, and then an intermediate group which has demyelinations that start usually in young adult. The current treatment for CMT1B aims at reducing the symptoms, the weakness, the foot contracture, deformities, and pain. And you probably know this better than me, but this consists in AFO, or physiotherapy, and occupational therapy, and various assistive devices. But what is exciting is that there are some research that has been going on in several lives that suggests that and indicate that at least at this point in mice, really work very well in improving the symptoms of CMT1B. And these drugs that have been identified, one of them is called Cephin, and alleviates this toxic response that I was talking about before, and is very effective because it seems to improve significantly the demyelination and some of the measures that doctors use to analyze the function of the nerve, so nerve conduction velocity, and the mice are able to run better, to make exercise indicate that their weakness is improved. So Cephin is entering clinical trial for other neuromuscular diseases, and a clinical trial for patients with CMT1B is being planned by the CMTA with the companies that make Cephin. For this same group of patients, I said that there are also impairment of this proteasome system that degrade things that are not useful for the cells. But recent study has shown, again in mice, that there are ways to reactivate this proteasome system using drugs that is exciting. They're already present in the marker because they're used for other things. So using these drugs in mice, researchers find that, again, demyelination, the nerve conduction, neurophysiology, and the weakness of the mice significantly improve. So even in this case, the CMTA and the investigators are working very actively with the company that produce this drug to test its safety and effectiveness in CMT1 patients planning future clinical trials. I guess that's... I'll stop presenting. Yeah, thank you Karas, this is a good question. We all want Cephin to hit clinical trial as soon as possible. I think the companies that make Cephin started a trial on another very severe disease, ALS, and that's what delayed a little bit the Cephin trial for CMT. But we are working very tirelessly to make that happen as soon as possible, although unfortunately I cannot give you a time frame right now. If there are any other questions, I'm very happy to address them. So, in general, trials are announced. Hi, Karen. In the depends where this will be a multi-centric clinical trials with many centers around the world, and certainly they will be announced by the CMTA Association and officially by the FDA government. On their side, there is a side for clinical trial, but I think you'll probably hear that from them from the CMTA first. The only medication that I'm aware of, I don't treat, I do research, so I was participating in some of the study I was telling you about. I don't see the patient, so I'm not maybe the right person to ask, but there are some medications that can help if you have pain, but not so much except for physical therapy and FAO that can improve, to my knowledge, the weakness. Yeah, that's a very good question, Molly. Is there any indication that the sync tool could be reversed? So the demyelination can be certainly repaired. If there are axons, the axons themselves are really damaged, there may be some regeneration, but it's probably not going to be very much. So I think there will be some definitely stop of progression, but also a little bit of improvement. I wish there would be some CMTA people. Certainly, yeah, to join the patient as partner is a good thing to do, but I will be asked talk to the ambassadors and patient liaison people at CMTA. I think they will have more information. Yeah, how do you know? Don is asking, how do you know the level of axon damage? Usually, this neurophysiological study, when I think they test neuroconduction velocity, which is a sign of demyelination, but also they test other things like called compound axon potential, and that is more of a sign of axonal damage. So when you do go take a neurophysiological test, there is an indication of how much axonal damage there is. Oh, thank you. Thank you. Yeah. Thank you, Sarah. Hi, Janet. That's a good question. So we could only answer that if sensory tests were done in the mice, and the mice were mainly tested for motor function. So we are not able to answer that question. The motor weakness was definitely improved. Would it help loss of cognitive abilities? Well, in general, cognitive abilities are not very much impaired in Charcot-Marie-Tooth 1B because there are not many central nervous system involvement. It's all in the peripheral nervous system. But I think in general it's possible. And again, it's something that the mice were not tested for, so we cannot answer this question at this time. I'm looking if there are other questions. So Pamela is saying, for 20 years I only had the diagnosis of idiopathic neuropathy. I found my biological theory was MPZ related CMT2. Would it make sense that I too have a gene mutation? Yes, definitely. I think it would be very important for you to get tested. And it's possible, as I said at the beginning, in CMT1B, you need only one of the two genes to be mutated. So you have basically a 25% probability to have CMT1B. So I think it would make sense, a lot of sense to have you tested for CMT1B specifically and for other CMTs in general, but specifically for CMT1B. So I will go ahead and do it. You're welcome, Pamela. What are the differences between CMT1B? Yeah. So as I said, depend on the mutation. In general, they tend to be a little. There are three categories. Certain mutation cause a very early onset, and certain mutation cause onset in the teenage years. They're slowly progressive, and that's similar to, for example, CMT1A. Instead, some of the CMT4s, for example, may be much more severe and starting very early. So CMT1B can be relatively late onset and relatively slowly progressive as compared to other CMT. But also depends a lot which kind of mutation in MPZ you have or someone has. So Christian asking, will two siblings both with CMT and a parent with CMT almost certainly have the same type? Okay, sorry, I also see Doreen. Let me answer Christian first. So no, they will not certainly have it. Depend on which CMT, if it's CMT1A or CMT1B. As I said before, you should have a 25% probability to have it. So it's not even more than 50%, but definitely is high probability. So it's important to get tested. If you know if there are other trials in the pipeline for CMT1B, not that I know, unfortunately. And that was for Doreen. So Sarah asking, how do you know the genetic cause of their CMT? In general, if you go to any CMT clinic, they will do genetic testing for you. That's the first thing that is usually done. There are still very few forms of CMT that don't have a gene identified, so it's possible that maybe the gene was not identified yet. But in general, any neurologist that treats CMT patient will send their DNA to be tested, and they will do the genetic testing. So Jenny asked if CMT can reduce respiratory and earth rate. They should not. Usually the nerves that innervate the diaphragm, for example, don't suffer so much. And specific heart rate, I don't think it should be influenced by CMT1B. Yes, so I don't have with me all the mutation. I can share, there are papers that describe the different mutation. I can refer you to a patient by Dr. Mike Shai, Iowa University, and he grouped the various mutation in two types. So what he called early onset, and were a group of mutations that you can find in his paper. And maybe if you want to send me an email through, I can write my email in the chat. I can send you that paper. Anyway, so yeah, so there are certain mutations that cause earlier onset and demyelination, and certain of them that cause late onset, and they're usually, certain mutations are known to begin earlier and other are known to begin late. And then there are the very late, which are CMT2. So I can send you that paper that deal with the demyelinating, so CMT1B, different type. There is another question from Karen. Neither of my parents nor any of my parents had any symptom. None of my siblings nor their kids have any symptom. How did I get CMT1B? Okay, the most important question is your parents. So it's probably, I don't know which kind of CMT1B you have, and if your parents are still alive, but it's possible that maybe you have a very late onset CMT1B, and it's so not severe enough to be really shown with symptoms. So you get CMT1B because you are passed on the mutated gene from one of your parents, but not necessarily every person has the same effect of the disease. And I don't know which mutation you have, so I cannot be more specific. But my daughter is the first in our family. This is from Molly. She's the youngest of my four daughters. She has CMT1B. Yeah, that's a good point. Thank you for reminding me, Molly. Sometimes mutations are not passed directly from your parents, but can just occur randomly during gestation and birth. And so it's possible that you have one child and none of the parents have the mutation. So that could also happen. And then maybe going back to Karen before, it could be what's happened to you also. Yeah, I mean, not as high as certain other diseases, but because there is some muscle atrophy, so the muscle, can be some creatine kinase levels raised. This is from Pamela. So Julie is saying that is interesting because my sister starting getting symptom in her 30 and worse in 40. I'm 51. And symptom I have at these past few years makes sense. I was wondering how many get. I don't see the rest of the question. in the screen. Oh, diagnosed later in life. Again, it's possible to get diagnosed later in life, especially for certain mutations. So earlier today, there was a mention of link between 1B and spinal issues. I didn't hear the comment. Do you remember what kind of spinal issues? That's definitely if has to be some very rare instance, but I didn't hear the conversation, so I'm not sure what you're talking about. Oh, scoliosis and others. Not very commonly. CMT1B is more commonly affecting the legs or the arms, the hands, so spinal nerves that are very close to the spinal cord is or bones are not usually, to my knowledge, affected. But again, I don't see patients, so maybe this would be a better question for clinicians that see CMT1B patient all the times. Can CMT cause strabismus? Again, it's possible, not very common. The nerves that control the eye, the muscles of the eye, are not very commonly affected by CMT1B, so I don't think it's very common. I heard recently, Julie, that CMT patients can have problems swallowing. I have a lot of problem with this. Any doctor say hiatal hernia. I wonder if I could possibly relate it to a CMT. I am not sure what type of CMT would have a swallowing issue. I guess it would be, yeah, it is possible. It would be a more severe CMT that target some of the nerves that are control the swallowing muscle, but so it's definitely possible, but I wouldn't say it's very common, or certainly not for CMT1B. Yes, please. I don't know. Yes, Sarah. Yes, please. I sent my email. That was maybe earlier, and I will. If you send me an email, I will send you the paper. I will share the paper by Dr. Shai that I was mentioning. I don't know if this is what you are referring to.
everybody. Thank you so much, Dr. Feltry, for helping us with talking about the subtype 1B. I just wanted to share that this is the end of our CMT Summit. So thank you so much, everyone, for joining us. And thank you again to Dr. Feltry for helping us answer all of the questions coming in about type 1B. If anyone else has any additional questions, please feel free to email us at info@cmtausa.org, and I'll put that here in the chat. And we'll make sure to get the questions over to Dr. Feltry.
Thank you
so much, everybody, for joining us, and I hope you have a great weekend.
It was a pleasure talking to you, and keep fighting because something good is gonna come. Don't give up the hope, and I really hope something will come soon for CMT1B, and we already heard a lot of the progress for other CMTAs, so keep the fight going, and you're all very strong, and it was a pleasure talking to you.
Thank you so much, Dr. Feltry. Have a great weekend, everybody.